We don't talk much about men's health, but the data suggest we need to. The average life expectancy for men in the U.S. is about 76 years old. That's around 5 years less than the average woman, and it's a number that actually has decreased since 2014, a trend we haven't seen in decades.
It's astonishing, and it really should be a wake-up call to us in healthcare, but also in society as a whole.
Dr. Alan Teo is a researcher and psychiatrist at the Portland VA Medical Center, where he estimates 90% of his patients are men. Teo says biology explains some of the differences between men and women's life expectancy, but so does behavior, especially in recent years.
And so some of the thinking here, I think, is that in recent years, some of these deaths by suicide, deaths by overdose due to our crisis of substance use disorders, opioid overdoses, those types of issues are really contributing to premature death and therefore lower life expectancy.
And not only are men at higher risk for certain behaviors, but research suggests they're also less likely to seek care.
It's a double whammy to both be at higher risk as a man to things like addiction and then be less inclined to seek care for those problems.
Another factor that could play a role: social connections. Numerous studies have found people with strong relationships are more likely to have better physical and emotional health. And Dr. Teo's research suggests men and women might approach those relationships differently.
One thing that we've seen in research, and this is maybe particularly so for older men, but older men are maybe more likely to have a less diverse social network. And I've talked to patients that I see here at the Veterans Hospital, at the VA hospital, where they really only identify their spouse, their wife, as their social support.
And with a less diverse network, the effects of losing someone in that network can be felt much harder. But the research on social connections also provides reason for optimism. In 2018, Dr. Teo found out of different ways to communicate, older adults who used video chat to connect with others were at lower risk for developing depression. It's something he practices with his own father.
Things are just stressful around the house with COVID-19 and us spending so much time indoors. I want us to be able to talk about those things. So I try and normalize it, and I try and use the technology as a way to enhance the opportunity to have meaningful conversation.
Above all, Dr. Teo emphasizes the importance of talking about mental health and rejecting the common perception that it's a sign of weakness, especially among men.
Talking about mental health, that's actually a sign of strength. I mean, the fact that you can reach out, talk with loved ones, talk to a professional like a psychiatrist or psychologist, if there's something going on, that is really a sign of being comfortable with who we are, and a real virtue.